Good evening. I have been eagerly anticipating this evening to discuss a common medical problem all of us face. It's allergies. It's my privilege to introduce our guest for this evening, Dr. Safadi. He was academically trained in allergy specialty from Cleveland Clinic, and we are proud to have him as well-known expert in our community. Dr. Safadi, welcome to our show.
Thanks for having me.
Thank you. The first question I want to ask is, what's the definition of allergy?
Allergy is an overreaction of the immune system to keep things that are foreign to our bodies from getting inside. So in a way, it's protecting us from those foreign objects, whether it's pollen, whether it's dust mite allergens, whether it's cat allergens. But it tends to overreact where the protection becomes a problem, and you end up with more symptoms and more sneezing and itching and coughing and wheezing secondary to that.
Sure. And how common is it as a problem, percentage-wise? Like, what's the percentage of population suffering from this allergy problem in the United States?
Studies over the last couple of decades have shown it to be anywhere from 10 to 20% of the population being affected. There has been some studies that showed an increase in the prevalence of allergies in the last decade or so, and especially most commonly noted with food allergies that have been on the rise as well.
And what could be the reason for that?
There are many theories. There's nothing for sure about those, but the most viable theory is the presence of the clean environment theory. The immune system was used in the past to fight off diseases and infections that we have eliminated, and at least some of the theories postulate that we end up with our immune system shifting from these bacterial infection fighting abilities to become more allergic to many things.
And I'm sure there's a different level of allergy. I mean, there's some of it, the mild one, and there's some of it which is the severe one. And distinguishing between the two, because I think if all of us, we think that we have some kind of allergy. I mean, otherwise, in that case, everybody will be your patient. So, and you will be happy probably. But in reality, when is the patient should go to the allergy specialist? We always go to our family doctors, to our pediatrician, and tell them, I'm having this problem. Is that the right things to start with? And then after that, when they think there's no benefit, they should refer them to the allergy specialist.
Well, absolutely. I think the primary care physician and pediatricians are definitely the first choice as far as seeking allergy treatments. We are lucky at this time and age to have available for us many treatment options. Many of these medications have become available over the counter. In years past, those used to be sedating medications, but in recent past, those medications have become more effective and less likely to cause drowsiness, and are certainly a first line. And most patients can do well with using those medications. However, when the allergies start to be inadequately controlled with these medications, when you start having problems with asthma symptoms because of allergies, when you start interfering with work and school absenteeism because of that, or start developing complications. Among those include sinus disease and recurrent ear infections, especially in children. Those have been linked to allergies, and if those are problems that are occurring, then it may be time to look more in depth, as if allergies are a factor, then there are maybe some other options to treat those as well.
Most people will have some problem with allergies or allergic reactions at some point in their lives. An allergy is an overreaction by the immune system to normally harmless substances called allergens. Common allergens include dust mites, pet dander, food, insect venom, and pollen. When people who have allergies encounter an allergen, such as pollen, for the first time, their immune system mistakenly believes that the allergen is a threat and responds by producing antibodies to fight them. These antibodies bind to specialized cells called mast cells. Once the body is re-exposed to the same allergen, it binds to the antibodies on the surface of the mast cells and triggers the release of chemicals such as histamine and leukotrienes. The release of histamine and leukotrienes causes many of the symptoms associated with allergies. These symptoms may include itchy and watery eyes, nasal congestion, sinus pressure, runny nose and sneezing, shortness of breath, wheezing, chest tightness, and coughing, and a general feeling of misery. Allergy symptoms can range from being mild to severe and can affect quality of life. In rare cases, an allergic reaction can be severe enough that it can be life-threatening.
So to get to that point, I'm sure you go through few steps of diagnostic measures. I mean, what is the most measures you take care? I mean, I always hear about skin testing and all of that stuff. If there's any way you shed the light on that.
Skin testing basically is what we call an outer skin layer or epicutaneous testing by placing a drop of those allergens on the skin and doing like a toothpick effect with a plastic tip device that introduces a small amount of that allergen into the outer layer of the skin. And we look for reactions in the form of like a mosquito bite reaction with redness developing at the site. We're able to get, based on that testing, how strong and severe the allergies are, and can plan as far as what's the ideal treatment options for that person. You can also do some blood tests, and those are readily available. And over the years, those have become also more reliable as far as kind of pinpointing allergic responses.
Is this the same applicable for seasonal allergy? You know, most of us sometimes when we get toward the fall and we start having some kind of sneezing, I mean, is that the same type of allergy? It still require the same kind of treatment and diagnosis?
Oh, immunotherapy and skin testing for seasonal allergies is definitely the best way to go for determination what is the exact cause of these allergies. And we've seen people where they get treated for allergies for years at times on the presumption that it is allergies, but it may not be, and the diagnostic testing would allow us to determine that. For instance, the fall season is the same time of year that we see an increase in the levels of viral infections. Kids are back to school, there's more exposure. At the same time, it's one of the strongest allergy seasons where you get ragweed allergy as well as high mold levels because of the leaves falling on the ground. So people who have allergies tend to have a lot of symptoms during that time of year. At the same time, there's a lot of those viruses going around. So is it allergy or is it a viral infection? And that's where the testing comes in play.
And what about pets allergy? I mean, I always hear about that. I mean, how valid is that point?
Oh, it's very common. As you know, we see quite a few patients who have cat and dog allergies, and as I mentioned, there doesn't have to be a pet in the house. They've measured cat allergens in classrooms. They've measured them in showrooms, in movie theaters. You can detect those allergens everywhere.
Sure.
And it's those are also more airborne, same as the pollen allergies. They're easily airborne, unlike dust mite allergies where they are heavy. So we tell patients, the difference between these allergens are with dust mite allergens, you need the covers for the pillows and the mattress. Those do help reduce exposure to dust mite allergies. On the other hand, air cleaners can help reduce pet dander and can help reduce pollen allergens, which are airborne allergens.
Pets allergy, I mean, I'm sure it's devastating to tell a child that you have to give up on your cat or dog. I mean, is it easy to treat or it's more difficult?
It is certainly not more difficult. You'll find some people who would recommend the removal of the pet from the household. That is something that we do not practice in our office. As I said, it's usually not a very successful measure. At the same time, I'm really not aware of definitive studies showing that problems have been resolved by removal of the pet. And again, that goes back to the same story that there is continued exposure to cat allergens in classrooms and other places. At the same time, treatment with things like immunotherapy or allergy injections for cat and dog allergens are very effective. And we've seen that based on the studies that have been published as well as in our patients. So usually within a year of therapy, many times these patients will notice significant improvement in their animal allergies.
Now, when we are talking about diagnosing allergy, I mean, is it time consuming? I mean, is it like a repetitive visits? Because I'm sure the parents, they have to commit themselves to bring their kids or whoever is a patient to come. Is it that way, or it's an easy process?
It's our staff is very familiar with patients of all ages. We test kids as young as a few months old, all the way to adults as old in their 90s.
Sure.
We do modify the testing when it comes to younger kids, especially when their skin is much softer, doesn't require us to really push hard, barely touch the skin with the different allergens. We do also sometimes more limited testing for the younger kids, because we don't need to know the individual trees or grasses, for instance, they're allergic to, but we'll do a mixed allergy testing, which is just minimizes the amount of pricks that we would do for them. Time-wise, it takes again for a young kid, actually doing the test might take a couple of minutes. They have to wait about 15 minutes afterwards to see what kind of reaction they develop. For adults, we might do some further testing, but in general, we tell our patients that when they're in our office, going over their history and exam and testing takes about 2 hours time.
What about treatment? I mean, I understand, like, we interviewed some of your patients who has treatment once a week and some of them once a month, depending on their progress. Is it the standard treatment, shots basically, to be done in the office?
Allergen immunotherapy, for many years, the only option we had is the injections modalities. In recent years, there's been some more studies looking into sublingual drops as another way to kind of desensitize for allergens. It's under a research modality of therapy. We're still not very clear as far what's effective dose, what's a safe dose when it comes to those treatments. But in the near future, I would hope that would become an available option. When it comes to injections, however, that's been around for 100 years. It's an FDA-approved modality that has been extensively studied and proven to result in an immune tolerance or removal of the allergies.
What's the success rate of the immune therapy injection?
Success rate, especially when it comes to pollen allergens and animal, cats and dog allergies, is more than 90-95%.
Wow. Wow.
So it's very effective for those allergens in particular. When it comes to dust mites and mold allergy, however, it's still effective, but to a lesser extent, about 75 to 80%.
Wow. Now I understand that, Dr. Safadi, you have quite few location offices. I just want to take the patient step by step into going into an allergy specialist office. I mean, I understand that you do all of these testing in one location. You don't have to meet the patient and then send them somewhere else to go and have this test here and that test here. You will be able to provide that full testing and diagnosis and treatment even in the same spot.
Exactly. Most of our patients, we do the testing and evaluation in the same visit. So that first patient appointment is the one that most of the testing and the results are known to them right away. So it doesn't matter which location they're in as far as the testing being done. The treatment depends if they are somebody who would benefit from immunotherapy or allergy injections. That's certainly something we would offer them. It's usually started within a few days to a week from that visit.
Sure.
Those visits, when they come in for their immunotherapy, are not considered office visits. They come in to get their injections. They're expected to wait after the injection for about 20 minutes
to be sure that there's
to make
no
sure that there is
reaction
no adverse reaction from that. But they're usually in and out of the office when it comes to immunotherapy or allergy injections within half an hour.
Welcome back. It's my pleasure tonight to welcome one of the patients who suffered in her life from allergy to tell us her experience about how was diagnosed, what kind of treatment, and to tell us exactly the suffering which she had during that period of time. And joining also with her mom. Here we have Kendall and Jill. Thank you for coming.
Thank you.
So Kendall, tell me about what age you were at the time when they diagnosed you with the allergy as described to you.
I was 10 years old, so I believe I was in 5th or 6th grade.
And what was the symptoms at the time, if you remember exactly what was going on?
I remember being in class and I was sitting towards the windows during the fall and they were open and I couldn't breathe and I couldn't really see because my eyes were itching so much, and I came home and I told my mom, and then we came and...
Who suggested to you that you have some kind of allergy at the beginning? I mean,
I think it was my mom. The pediatrician. Yeah, pediatrician.
Okay. Was your family doctor helpful also to guide you toward that direction? So, so you mentioned it to your family doctor first, who really, I call the family doctor is the captain, and he's the one who really send the patient right or left. So I want to emphasize on how important to bring it to the family doctor attention. And then you went to the allergy specialist, and I'm sure they did some testing for you.
Yeah,
was
allergy
it the
testing.
tough testing? Or?
Yeah, because I was young and I was scared, and it hurt because, I mean, I have a lot of allergies, so everything puffed up on my arms. But, I mean,
so when they did those testing, I mean, was it a bad experience? I mean,
no, I was just scared because
scared. So
yeah,
if you knew about it probably, or if you watched it on a TV program like this, probably it would be a little bit easier?
Yeah. A little bit.
Okay. So after the doctor did the testing and they came back and told you that, here we are, we have these problems. How many allergies you had?
I had a lot. I remember everything on my arms were puffed up, so definitely a lot of allergies I had.
Jill, taking care of children who have an allergy, how easy, how difficult it was for you at the beginning when she coming from school and telling you, I couldn't breathe, I'm having a problem, until you made the diagnosis with the physician who taking care of her. Was it really a difficult process for you?
It was scary because she also at night was having a hard time breathing, and I couldn't figure out what was going on. So that's when we went to the pediatrician. And I told him about her symptoms, and then also when she was around any animals, the sneezing, the eyes itching. So it was scary at first, and then until we had the testing done and found out she was allergic to so many things.
Does it take the parents a lot of commitment? Because, you know, at younger age, I'm sure she wasn't driving. You have to take her to the doctor twice a week, or, I mean, at the beginning, the way she told us. I mean, is that a difficult thing for you, I mean, to do?
But it was helping her, so I was really happy to do that for her because she was so miserable. But, I mean, it was just became routine. Every Thursday, pick her up from school and we go and get the shots.
What about the people around you? I mean, when the neighbors ask you about her condition, about the allergy, and you try to explain to them, are you trying to convince them really how important it was to make the right diagnosis and to go to the doctors? Or, I mean, everybody, you know, some people, oh yeah, it's an allergy, what's the big deal?
No, because since she was so bad, and we'd explain to people, because people would notice how bad she was and wondering what was going on, so explaining it to her. And they could actually, because she plays soccer, so, and she was outdoors a lot, so we really had to make sure we got on top of this, because if we didn't, like I said, the one day she came home from school, she couldn't see, she couldn't breathe, and I was really scared.
Sure.
Yeah.
And how about the treatment?
I got shots every week, 2 shots every week, and then it helped, and then I went to 2 shots every other week, and that helped even more, and I got even better, and now I'm at 2 shots once a month, so.
Okay, and that's helping?
Yes,
so you are doing basically a maintenance treatment at this point to prevent you from having that allergy coming back. And does it bother you too that you have to go to the doctor office every month, I mean, to do this?
No, not really, because I love going. I like
really?
Trisha.
So you love that?
Yeah, they're nice, and
we really appreciate both of you being here. It was very helpful for giving us some information about your experience and your experience also, and we hope to shed the light to everybody about allergy, how easy to diagnose, how easy to treat, as long as we go to the right place and the right position, the right physician to take care of that problem. Thank you so much.
Thank you for having us.
Another patient we're going to discuss today is Grant and his mom, Jody, here, who are going also to help us to understand allergy concept in children. Jody, when they told you about Grant that he's having allergy, what was the most common symptoms he's having? What kind of allergy he was having?
He was having the cough and the runny nose and blowing his nose and a lot of congestion, and then he would eventually throw up. His asthma was acting up because of the allergies, and we first started with the pulmonologist, and a lot of medications were prescribed, and then we went from there to the allergist and found out what he was allergic to and decided to do the shots.
So he had asthma,
Correct.
and his allergy made his asthma much
Correct.
worse, definitely.
Yes.
How old was he when he was diagnosed with that kind of allergy?
I think he was 10.
10 years old. Grant, how old are you?
I'm 11 now.
What kind of sport you play?
Football and basketball.
Are you a good player?
Yeah.
What are you, the star of the team or not yet?
Yeah, I'm starting.
Okay. So tell me about your allergy. I mean, your mom mentioned that how much you were coughing and you were having your asthma getting worse because of the allergy. Do you remember those days, I mean?
Yeah.
And was it bad?
Yeah.
And now how you feel after you start getting the treatment from your doctors?
I'm feeling better now.
How much better?
A lot.
A lot better.
Yeah.
So you feel that you are back to normal.
Yeah.
Okay. Does it hurt when you're getting those shots? I mean, the allergy shot?
No.
Are you serious?
Yeah.
Come on.
Yeah.
I'm just trying to emphasize on that to the people. I mean, trying to make the girls think that you are a strong man.
No.
Okay. Very good. Thanks. What about this? What do you have in your hand?
I have an EpiPen.
What's that?
It's if I get stung by a bee, I would have to like poke it right in my thigh for like 10 seconds.
Okay. And so you have allergy to bee, I assume.
Yep.
And this is, you know how important is this, right?
Yep.
This could save your life.
Yeah.
Okay. And do you understand how fast you have to get it, and they taught you how to do it and everything?
Yep.
Is it difficult?
No.
It's not. This is really a very important step. As you can see, he has this package which could save patients who has a significant amount of allergy, specifically what we call anaphylactic reaction, because as fast as they get this injection, their symptoms will be relieved and it could save lives. Some people, they end up on the ventilator because of the allergic reaction they develop. And I'm glad that Grant always taking it with it. You take it to the football field also when you play?
Yep.
Excellent. Thank you. You know, we are getting close right now to fall, and at the same time, kids are probably soon going to go back to school. What is your advice to the parents of these kids? I mean, and how can they prevent their kids from having any major allergic reaction? At the same time, what they should do during this period of time?
Well, a couple of things actually. You know, the ragweed season this year usually starts in this area somewhere around August 15th, and it's pretty close, plus or minus 2 days. So many times, however, people don't start feeling the symptoms right away. It takes a couple of weeks before their immune system becomes primed, so that their allergy symptoms start building up, and more symptoms develop as time goes on. It is an airborne allergen. It's very prevalent in this area, and we're expecting this year to be a strong ragweed season based on the amount of rain we've had in recent weeks. So trying to stay indoors can help, but that's going to be a hard thing with many kids. Just be aware too that if it's been kind of wet and rainy, there's less pollen in the air. If it's more dry and windy, there will be more pollen, as well as there are certain times of the day which tends to be worse as far as pollen in the air.
Sure.
And that's, you know, early morning, late evenings tend to be worse than middle of the day.
Thank you for joining.